and having the last word when all of these amazing people are talking, and having the last word when Greg is one of those people, or do I call you Dr. Nolan, is something I obviously will not turn down. It's hard to have the last word after Richard, to be real honest. I could have said that's the last word. First of all, I want, on behalf of all of us here, to thank Kadwell. I think we all, throughout the years, and certainly some of us on a daily basis, are grateful to Wilder for what we know about what we're doing because of the work that's done here. So thank you, Greg, and thank all of your colleagues who do this work. And then, of course, I want to thank everybody in this room and all those who aren't, who work on this issue day after day. Whether you are working as a service provider, a housing manager, a person in the system, any place along the way, including some of us bureaucrats who scratch our heads over some of the craziness that we face every day. Thank you to you. And I think Erica must have left, but I did want to say my thanks to Erica. Oh, Erica, wherever you are, thank you very much for your work. And over the years, I think many of us have run into youth who have been inspired to do something about this issue for the very reasons you've heard this morning. I think especially from Beth and the need for compassion in our society, and we express that as well today. Thank you. I am going to be brief because so much has been said that one could not summarize it, but I do want to call attention to a couple of main points. Paul and Greg at the beginning talked about the difference between individual issues and structural issues. I think that we do focus a lot on individual issues. How can we help this person with his or her mental illness, for example? We need to turn our attention to the structural issues. I think that there is something in between those, though, and Frank alluded to this in his remarks, and that is the systems change piece. And I think we all know that there is a lot of money being spent now in our system on folks who have experienced homelessness, who are experiencing homelessness. The issue becomes, how do we transfer, how do we change those expenditures from expenditures on services that don't really get the person anyplace to services that do? How do we translate the expenditure in detox to an expenditure on supportive housing? How do we translate the expenditure on an inpatient hospital stay because of a condition that is exacerbated, as Michelle pointed out, by being homeless? How do we transfer that to an expenditure on preventive care, on housing, if you will, on things that keep people from becoming homeless and prevent the kind of illnesses that are exacerbated by homelessness? That, I think, is the question that we all need to be thinking about in the next several years. Over the past 5 years, I think we've seen a lot of changes. We've stopped talking, and I realize that we haven't accomplished ending homelessness. If we had, we wouldn't be here. But there are more and more people throughout the state of Minnesota who understand that what the system that we have now does is manage people who are homeless, manage homelessness, as opposed to ending homelessness. And I think we've all had our eyes open about what it means to end homelessness. We have moved, I think, we are moving from a focus on individual programs to a focus on how can we change the system. Beth mentioned, how do we reform the child welfare system? Michelle mentioned the fact that she sees people who are hungry, people who need health care, people who need transportation. These are all of a piece. And I'm here to say that even at the state, there is more attention being paid on the individuals and families that need attention and what do they need, as opposed to focusing on what are the programs that we have that we can beef up and invite people to. Those are two very different questions. Whether we're talking about the plan to end long-term homelessness, the reentry work that's going on at the Department of Corrections, the at-risk adults initiative that's going on at the Department of Human Services, all of these things, the fundamental question that's being asked is, who are the folks and what do they need? And I think that that is the sense in which we have turned the conversation. I would hope that everyone in this room has the kind of passion that Liz exhibits in her work. And that's her work as an advocate and her work as a council person. Because we need people in every walk of life throughout our community to be thinking about this issue with their heads and feeling it with their hearts. I think as we go forward, we are going to see more of what you heard this morning. And I'm sorry to use this phrase, but I can't think of a better one right now. Slicing and dicing the population. I know the plan to end long-term homelessness was criticized at the beginning because we basically took an approach to long-term homelessness among singles and used that same approach for youth and families. I think we've learned in the past 5 years that we need to do more work to say, how do we end long-term homelessness and homelessness for families? How do we end long-term homelessness for youth? And that these are different approaches than they are for singles. And the other thing I think that we're starting to ask ourselves is, what is the appropriate point of intervention? Obviously, I was truly discouraged, I'm sure everybody in this room was, to see the numbers go up and to see the numbers of people experiencing long-term homelessness go up. The question that the long-term homeless numbers raised for me was, we're doing a pretty good job when people have been homeless for a long time, knowing what they need and creating housing for them, yada, yada. What we're not doing so well is keeping them from becoming long-term homeless in the first place. So how do we back up this system? We're asking ourselves a number of those questions as we put together a state plan to prevent and end homelessness. You're all invited to participate in this, and if you want further information, if you don't have it already, let me know. I'm going to make only one other point, and that is this. We not only have to slice and dice, if you will, how we approach various populations and their homelessness, we also have to slice and dice how we appeal to greater Minnesota, and I don't mean the geographic area, I mean the people of Minnesota. How do we appeal to this community to join us in this effort? I think one of the things that we've learned in the past couple of years, it's not all going to happen through the heart. Some of it has to happen through the head. How do we create the arguments that will help us reach more and more people in Minnesota? Because ending homelessness in our state is not so much a matter of money, although it is also that. It is a matter of creating the political will to get the job done. There is a quote that I read recently of Gina Davis. And the quote is, when we risk nothing, we risk everything. And I think that is exactly what we're saying when we go out and we say to people, we need to address this issue. We are risking the lives of people in our community. We are risking not having everybody in this community returning to the community that of which they are capable. And that is, to me, is the saddest part about homelessness. Richard expressed that so well when he told about the people that are at St. Stephen's and what he sees on a daily basis. When people don't get housed, they don't have a chance to reclaim their lives and to contribute again to the community. That's what we're risking, that's what we're losing, and I think everybody in this room knows that, and we're going ahead to end homelessness as among all the populations we've talked about today. Thank you.